I'm 20 and have had big bags under my eyes since I was 7. What are my best options? I'm a 20-year-old female and have had puffy eyes for as long as I can remember. I used to get bad allergies in the spring, which I believed was the cause of it. However, I haven't had allergies in years and still have these bags. I am desperately looking for a procedure other than invasive surgery, and I feel that the bags make me look unhappy and old. What are my best options?
Thank you for your question. You're 20 years old, you submitted a single photo, and you stated in your question that you've had under eye bags since you were 7. However, you felt that earlier your under eye bags were related to allergies, and as your issues with allergies improved, the under eye bags remained. You're looking for a solution other than, quote, invasive surgery. You feel like the under eye bags make you look tired and old. Well, I can certainly give you my perspective on how I approach patients like yourself in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and under eye bags is one of the most common issues we address in our practice. So to begin with, it's very important for you to understand the relationship between allergies and other factors which contribute to the presence of under eye bags. Yes, allergies can make under eye bags look worse, but when you think about it, understanding that bags that are always there regardless of the presence of allergies means that there is something more anatomic that's constant. And what is that? Well, what that is, it's called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around your eyes pushes forward and creates a bulge under the eyes that makes the eyes look tired. Now, we live in a time where we do have more than a few ways to address the cosmetic appearance of the under eye bags. And so it's clear that you are concerned about undergoing surgery, but I can share with you basically the way I discuss the options with my patients in my practice. For someone who has a small degree of puffiness, where it's kind of a little just mild and present enough that they notice it, but not significant enough that it's really pushed forward, we can offer the option of a non-invasive approach where filler is placed under the under eye bag in the hollow area. This area is commonly referred to as the tear trough. And the way that's done is still a procedure. So you stated that you were concerned about invasive surgery. I would say to you that really even placement of a filler is invasive. Anytime you go through the skin, you are technically invading the space. So whether it is through a surgery or with an injectable, understand these are invasive procedures. They are different degrees of invasiveness, but it's still invasive. Going back to the strategy, what we do is we place filler using special instruments referred to as blunt cannulas into the tear trough area and add volume so that the hollow becomes less obvious. That can, when you place a filler in this area, you're essentially softening that appearance, and that filler can last from anywhere from 6 months to several years. Very often we also try to improve skin quality. To improve the skin quality, we use something called platelet-rich plasma. Platelet-rich plasma improves the quality of that very thin skin under the eyelids, which can be affected by typically environment or eye rubbing and allergies and other issues which can make the skin look more older than the rest of the skin on your face. So platelet-rich plasma is also an option. Last is a surgical procedure, but I would submit to you that it is less invasive than you may have an understanding of at this point. The approach is called a transconjunctival blepharoplasty. What I'm doing when we do this procedure is addressing the fat pockets from the inside of the eyelid. Once I address the fat pockets, I'm reducing, sculpting, repositioning as is appropriate to get the most optimal result so that the fat that's prolapsed no longer is pushing forward. Now, the appeal to this approach is that it's a long-term solution. For someone who's younger, who doesn't have the other elements of facial aging, doing a transconjunctival blepharoplasty, sometimes combined with platelet-rich plasma, as described earlier, is a definitive procedure, and you don't have to repeat it. When you have, or I should say you don't have to repeat it for many years, particularly when you're doing this as young, and we often say that eyelid surgery can last anywhere from 5 to 10 years, but in a younger person, I would say it goes even well beyond that. When we talk about fillers and other maintenance procedures, there is some ongoing placement and replacement as the material breaks down. So there are pluses and minuses to the different options, and it's important that you get a proper understanding and perspective. This means having a proper examination and having a meeting with a doctor who can offer you all options, not just one or the other. So my recommendation is meet with qualified, experienced cosmetic surgeon, learn about the options that I described about lower eyelid transconjunctival blepharoplasty, the use of platelet-rich plasma for skin quality, and the use of hyaluronic acid filler such as Restylane for volume correction to try to soften the appearance of the under-eye bag. Once you figure out what works best for you, you can move forward. So I hope that was helpful. I wish you the best of luck. Thank you for your question.